I'm Anita Siddall, and I've been a registered dental hygienist for 36 years. In order to keep my license, I have to have 30 hours of continuing education credit every biennium. And during that time, I've definitely learned that one of my favorite topics is how oral health affects systemic health. And that's what this whole video is going to be about. There's numerous research on how oral cavity and systemic are linked. I bet you didn't know that conditions like Ehlers-Danlos, allergies, menopause, pregnancy, they're all seen in the mouth. Even medications can cause oral changes and vitamin deficiencies. You've heard that periodontal disease is associated with heart disease and diabetes and even low birth weight babies. But did you know it's also associated with Alzheimer's disease? At Toothbrushes and Balaam's Donkey, we say that your mouth mirrors your health, and we're really trying to help people have whole body health by helping them have healthier mouths. I'd like to explain a simple truth about oral health that we all can benefit from, and that is no matter what health condition you have, what medications you have, what genetic predispositions you have, quality plaque control can benefit your mouth and therefore benefit your overall health. Let me show you simply what's happening every day in our mouth. In a healthy mouth, you see pale pink gums. The gums are the skin above your teeth, and they are thin, they are attached closely to the bone, and they have a very sharp knifed edge point next to the tooth. That point that goes between every tooth is called an interdental papilla, and that should be a very sharp point. You'll see that this is a typical healthy mouth. And healthy mouth does not equate with youth. People often get the misnomer that if you get older, your mouth gets less healthy, and that is not true. People can have healthy gingiva throughout their whole life. Plaque is accumulating in all of our mouths all day long, and plaque is filled with bacteria, fungus, and even viruses. And the organisms are growing all day long, and so in order to stay healthy, we have to remove this adequately. So when plaque is left alone, it wreaks havoc in our mouth, and as it grows and teams up, it actually starts a condition called gingivitis. And gingivitis at first only affects the gingiva, which is just the skin. It looks like a light red line right next to your teeth. And you can see in the picture that the gums haven't really changed immensely, but you can see the redness next to the enamel, and it depends on where you're missing plaque, that's where it's going to show up. So it could be all over your mouth, or it could just be even localized to one or two teeth. If we would allow the plaque to grow and accumulate, meaning we're not removing it properly, it's going to advance and cause more inflammation. And that inflammation is going to progress to the supporting structures of our teeth down into the bones. This is when we call it severe periodontitis. When we get severe periodontitis, the gums change significantly. They get thicker. The pointed knife edge that we were talking about is no longer there. It looks rounded, and color gets red. And if you could go below the skin, you'd see that the bones start to get destroyed as well. Some of the bacteria that's in the plaque produces acids, and those acids actually start to eat down our enamel and the root surfaces as well, and we can get cavities. So the cavities on this picture are on the root surfaces that have been exposed. So this person had periodontal disease, which exposed his roots, which put the roots higher at risk of cavities, and then he had plaque that wasn't removed, and that plaque caused decay. I have a model here. This model is a great way to see periodontal disease compared to healthy. This side is a replica of disease, but what I want you to see is the bone underneath. On this model right here, this side shows healthy bone level, all right? And the gums would just be above that bone level. Get my pointer here. Would just be above that bone level, and it would come to those nice sharp points that we talked about, and the gums would lay real tight against this bone level. And if we don't remove the plaque adequately, the bones start to get destroyed. So I'm going to show you the other side of the mouth. And you can clearly see that the chronic inflammation that's caused from that plaque that's in our mouth all day long actually will start to destroy the structures that hold our teeth in. And like this guy right here just fell out when I was messing with the gums because he doesn't have enough bone support right there. And all this marks of dark and brown are a replica of the material that we take off at my job. It's plaque that wasn't removed, and then it mineralizes. It picks up minerals from our saliva, and it turns into a really hard deposit that need to be cleaned off because it's extreme irritant to the gums. So periodontal disease, very destructive, and when the teeth have gum disease, the gums are big, bulgy, and they stick out from the teeth, and they aren't closely adhered to the bone underneath. So this is what a kind of a typical periodontal disease mouth would maybe look like, but it gets worse when you see even underneath it. So periodontal disease is a destructive disease. It gets in not only our mouth, but it's part of our whole body. Plaque removal in the presence of severe periodontal disease requires unique tools and training. As the disease progresses, the level of skill required to remove the plaque increases. Proper plaque removal can make the disease stop, and it even can make it much healthier. Adequate daily plaque removal is essential for oral health. And the one thing I'd like to note is that there is no mouthwash that removes plaque. There's no medication that removes plaque. The only way you can remove plaque is with a mechanical means, like with toothbrushing, flossing, water picking, using toothpicks, soft picks, tools that go mechanically to wipe the bacterial plaque off. So healthy mouths, that's what we're after.